Your eyes are more than windows to your soul. They're crystal balls that can predict your death. Hidden in your iris, retina, and the tiny blood vessels of your eyes are clues that medical science is only now beginning to understand. These microscopic details can reveal not just how long you live, but what will likely cause your death decades before symptoms appear anywhere else in your body. What you're about to discover isn't mysticism or fortune-telling. This is cutting-edge medical research that's revolutionizing how doctors predict and prevent disease. By the end of this video, you'll know exactly what to look for in your own eyes and how these discoveries could save your life. Let's start with the most shocking discovery, the corneal arcus. This is a grayish-white ring that appears around the outer edge of your iris, and if you have it before age 45, it's a warning sign that could predict heart disease decades in advance. This ring forms when cholesterol and fatty deposits accumulate in your cornea, essentially creating a visible marker of what's happening in your cardiovascular system. Studies involving thousands of patients have shown that people with corneal arcus under age 45 have significantly higher risks of heart attacks and strokes later in life. Your eye is literally displaying the same process that's occurring in your arteries, fatty buildup, that leads to blockages and cardiovascular death. But the corneal arcus is just the beginning. Your retina contains the only blood vessels in your body that doctors can observe directly, without surgery. When an ophthalmologist looks into your eyes, they're seeing your cardiovascular system in real time. The condition of these tiny retinal blood vessels mirrors the health of blood vessels throughout your entire body, including those in your heart and brain. Retinal vessel analysis can predict stroke risk with remarkable accuracy. Narrow, twisted, or damaged retinal blood vessels indicate similar damage is occurring in your brain's blood vessels. Doctors can now use artificial intelligence to analyze photographs of your retina and predict your stroke risk up to 5 years in advance. With over 80% accuracy, the color and clarity of your retina also reveals crucial health information. A pale retina can indicate anemia, kidney disease, or blood loss that you might not even know you have. Yellow deposits called drusen in your retina are early warning signs of macular degeneration, which can lead to blindness. But they also correlate with increased risk of heart disease and cognitive decline. Your pupil response reveals the health of your nervous system and can predict neurological diseases years before other symptoms appear. Pupils that react slowly or irregularly to light changes can indicate early Parkinson's disease, multiple sclerosis, or even early-stage dementia. This happens because these diseases affect the neural pathways that control pupil function, long before they impact motor skills or memory. The pressure inside your eyeball, called intraocular pressure, doesn't just predict glaucoma. Elevated eye pressure correlates with high blood pressure throughout your body and can indicate increased risk of cardiovascular disease. Some researchers believe eye pressure measurements could serve as an early warning system for hypertension-related health problems. Even more fascinating is what your iris reveals about your genetic predispositions. The patterns, colors, and structures in your iris are determined by the same genes that influence your susceptibility to various diseases. While iris analysis for health prediction is still emerging, some studies suggest that specific iris patterns correlate with increased risks for autoimmune diseases, diabetes, and even certain cancers. Your eyelids and the skin around your eyes can also predict longevity. Xanthelasma are yellowish patches that appear on your eyelids due to cholesterol deposits, like corneal arcus. These visible markers indicate lipid metabolism problems that significantly increase your risk of heart disease. People with xanthelasma have double the risk of heart attack compared to those without these deposits. The condition of your tear production reveals information about your overall health and aging process. Chronic dry eyes aren't just uncomfortable. They can indicate autoimmune diseases, like Sjogren's syndrome, which affects your entire body's moisture-producing glands. Poor tear quality also correlates with increased inflammation throughout your body, which is a major factor in accelerated aging. Recent research has revealed that your eyes can even predict Alzheimer's disease decades before memory problems begin. The retina is actually an extension of your brain tissue, and changes in retinal thickness, blood flow, and protein deposits can indicate early brain degeneration. Some studies suggest that retinal scans could detect Alzheimer's-related changes 20 years before clinical symptoms appear. Your eye movements and visual processing also reveal cognitive health, difficulties with smooth eye tracking, problems with visual attention, or changes in how quickly you process visual information can all indicate early cognitive decline. That hasn't yet affected other mental functions. But perhaps most importantly, your eyes reveal your biological age versus your chronological age. The blood vessels in your retina show the same aging changes as blood vessels throughout your body. An AI analysis of your retinal blood vessels can determine whether your cardiovascular system is aging faster or slower than expected for your chronological age. This biological age measurement from your eyes is incredibly predictive of lifespan. People whose retinal blood vessels appear older than their chronological age have significantly higher death rates from all causes. Conversely, those whose retinal vessels appear younger than their actual age tend to live longer, healthier lives. So how can you use this information to potentially extend your life? First, get regular comprehensive eye exams. Most people only see an eye doctor when they have vision problems. But annual eye exams for adults over 40 can catch life-threatening diseases in their earliest stages. During your eye exam, ask your doctor specifically about the health of your retinal blood vessels, your corneal clarity, and whether they see any signs that might indicate systemic health problems. Many eye doctors are trained to recognize these early warning signs, but might not discuss them unless you ask. Pay attention to changes in your vision, pupil responses, or eye comfort. Sudden changes in night vision, difficulty adapting to light changes, persistent dry eyes, or new visual disturbances could all be early warning signs of serious health problems that extend far beyond your eyes. Protect your eye health through lifestyle choices that benefit your entire cardiovascular system. Regular exercise, a diet rich in omega-3 fatty acids and antioxidants, adequate sleep, and protection from UV light all support both eye health and overall longevity. Consider asking your doctor about advanced retinal imaging if you have risk factors for heart disease, diabetes, or neurological conditions. These scans can detect changes years before they show up in traditional medical tests. Remember that while your eyes can predict many health problems, they're showing you information about modifiable risk factors. A concerning finding in your eyes isn't a death sentence. It's an early warning system that gives you time to take preventive action. The field of using eye examinations to predict overall health and longevity is rapidly advancing. In the near future, a single photograph of your retina might provide more information about your health risks than traditional blood tests or physical exams. Your eyes have been trying to tell you about your health for years. By learning to read these signals and taking appropriate action, you can potentially add years to your life and life to your years. Look in a mirror and examine your eyes carefully. What you see there might motivate you to make the health changes that could save your life. What did you notice when you looked at your eyes? Share your observations in the comments below. And if this information helps you understand the hidden health secrets your eyes reveal, hit that like button to help others discover what their eyes are telling them about their health and longevity.